On the 23rd and 24th of August, Stockport Link invited several service providers and commissioners along to our Link briefing sessions to talk to the Link about their service and to allow Link members and members of the public to ask them questions. The reason for the two briefing sessions, rather than our normal one-a-month briefing session, is we had a special briefing session on mental health services on the Tuesday, followed by our regular briefing session on the Wednesday.
Hi, we've just been speaking to the Link about mental health services as they currently operate and what we want to see in the future. There were three of us, myself as the Mental Health Commissioner for the PCT and the Council, Dr Hussain from the Clinical Governance Commissioning Group, Stockport Managed Care, and Cara Manili from Pennine. And we've just had a great 3.5 hours, and I'm worn out now. Lots of questions and lots of challenge about where we're going with mental health services. We've been able to talk a lot about the future and the new vision, about reducing the numbers of people in Pennine care, helping people to step down and step out of those services and move back to being contributing citizens and how we're going to do that. And I was able to talk about the successful bid we've just heard about from an organisation called Nesta. Stockport's been chosen as one of 6 sites nationally to have an investment which will help us to support that new ways of working. So that's all good news. And
hi, we invited as the Link commissioners and providers to tell us something about what's happening in mental health in Stockport, and we found it very informative.
And we hope that all the wonderful things that we heard today that we will see out in the community actually working for our people who are mentally ill.
This morning I looked up Link's website for something particular, and I realised there was this meeting this afternoon addressing mental health in Stockport. And I found, to my surprise, I already had marked links on my memo. So I thought this was too good to miss. And I hope to come to more meetings because I think they're excellent.
I'm Pam Southcombe. I'm one of the health protection nurses in Stockport, working in Dr Baxter's team. My responsibility is to look at immunisations in Stockport and try and get people to have their vaccinations. I came to the Link group today to talk about influenza and the influenza campaign that we're running in Stockport. The flu campaign will start with a media campaign in September, and then flu vaccine will be available from October at GPs.
Hi, my name's Shirley Hamlet. I'm from NHS Stockport's Community Engagement Team. And I've come here today with Angela, my colleague, Angela Begbie, to talk to the Link about any qualified provider extending choice.
Department of Health wants us to extend 3 areas of healthcare services where from April we'll be giving patients more choice of who can provide the service for them. So the views of Link and other people in Stockport through our online survey are going to be presented to the Greater Manchester cluster to help inform their decision. If you want to complete the survey yourself, you can go onto our engagement website. So if you go to www.citizenspace.com/Stockport-have your say.